Hello, and welcome to Upfront. My name is Dean Thullner-Veljasic, and we are filming on the unceded Snuneymuxw traditional territory. It seems that a hot topic of conversation these days is all about healthcare. On this episode of Upfront, I have the privilege of sitting down with Donna Hais, who is the chair for advocacy group called Fair Care Alliance. Hello, Donna. How are you?
Great, Dean. Thanks so much for having me today.
Well, thanks for coming down to the studio. As I said, healthcare. So many people are talking about healthcare. Fear of not getting healthcare. Will I get the services I need? If I go to the hospital, how long will my wait be? So let's start off by saying, or telling the audience, what is Fair Care Alliance?
So the Fair Care Alliance is a community advocacy group who has come together to educate and provide information on what an individual's access is to healthcare amenities for those of us that live north of the Malahat, so Central and North Island.
Mm-hmm. And you must have a mission, you must have a trajectory of what you want to accomplish. What is the mission for this organization?
So the mission for the Fair Care Alliance comes directly from the healthcare ecosystem, which has been developed for our Central Vancouver Island area. And the healthcare ecosystem is made up of larger organizations like MSA, the Medical Staff Association, Nanaimo District Hospital Foundation, City of Nanaimo, Regional District Hospital Board, School District, University. They've all come together to form a healthcare ecosystem for Central Vancouver Island. And together they formed a mission which they put together that the Fair Care Alliance has adopted. And the mission for us is to provide fair and equitable and culturally appropriate access to tertiary healthcare for those of us living Central and North Island.
Mm-hmm. This is fantastic.
That's the mission. It's big.
Yeah, of course. Well, we need better healthcare in Central Island. We have a population here that's aging, and we are not up to standard to be able to supply the services and the needs of this population at this time, correct?
No, that's correct. We are the oldest population in Canada in Central and North Island, and we're the 5th fastest growing population in Canada. You add those things together, that talks about that our patients are more acute. They have more acute diseases that need more attention. And to be honest, we don't have the infrastructure to help them.
And why don't we have the infrastructure to help them?
Well, I think in the past we've been neglected by government for a number of years. Nanaimo Regional General Hospital is the 7th largest hospital in the province of BC. Mm-hmm. Since 1996, there have been 19 new hospitals or rebuilds of the hospital, and Nanaimo has yet to get the announcement of a new tower or a cath lab, which we desperately need. Our hospital was built in 1962.
I believe the hospital was built for 40,000 people, and 120,000 people are going through annually, at least every year. Yeah.
At least.
Okay, so I want to circle back here. 2nd fastest growing city in BC, 5th fastest growing city in Canada. If we're growing that fast, why are we not attracting doctors and healthcare professionals to be in our community?
So it's really hard to attract the medical professionals that you need when you don't have the infrastructure to support them. Right. So, I'm going to focus a little bit on cardiac care through this conversation because it's obviously a really hot topic, with heart disease and stroke being the #1 killer of Canadians, right? And we don't have a cath lab here. But how do you attract a new cardiologist here when you don't have a cath lab?
So just quickly, for those that don't know, what is a cath lab?
It's to provide a stent for your heart, so a catheterization lab. So there are 2 in Victoria, there are none in Nanaimo.
Mm-hmm. Well, that's not good enough. The other problem I understand is that if someone were to have a heart attack or someone were to need services, it's quite a distance away to get what you need. Like perhaps NRGH may not be able to help you. You might be taken to Vancouver or to Victoria?
Well, unfortunately, Dean, that's the reality right now. So the statistic is, and the Canadian standard of care by which all Canadians are supposed to receive their cardiac care, is 90 minutes from PCI or from your heart attack until you get to a cath lab. So that really isn't possible living north of the Malahat. That means we have to right now, anybody living in north of the Malahat has to get to Victoria. So you can imagine, you have a heart attack. We could have a heart attack right here. I could have one right now.
Please don't.
No, you need to call an ambulance to come and pick me up. They will take me to NRGH, where they will say, we need to get Donna to a cath lab.
Right.
Where time is ticking, and minutes are muscle. So every minute that we are away from the event and you get the healthcare that you need, that muscle starts to die. And your chances of coming back to a full and healthy life after that, what your quality of life looks like after that delay in getting the care you need, it goes down by every minute you delay. So getting me, if I had a heart attack here, to Victoria in 90 minutes, yes, it involves an ambulance ride, it involves a stay at the emergency room in NRGH, it involves possibly a helicopter, if a helicopter is not available, an ambulance, but all of that only happens, the helicopter or the ambulance to Victoria, if I'm approved by the cardiac program in Victoria to be given access to the cath lab.
I see.
So our doctors in Nanaimo have to phone to get permission for us to be able to go to Victoria and have access to that care.
Such an unnecessary step. I mean, they're already overrun with everything they're dealing with within the walls of NRGH anyway.
It's delays.
Okay, so what about some of the other statistics? 80% of the island's First Nations are NRGH catchment area.
That's correct.
Yes.
That's correct. That's a large population of First Nations. And that's why you'll hear in our mission and our vision statement, we want to make sure that everyone coming to NRGH receives culturally appropriate health care.
Absolutely.
It's really important to us.
Yeah, of course. So why do you feel our healthcare system is not prepared? So I want to go through some of these things. It says the NRGH is the busiest ER in the island. So is it busier than Victoria or busier than Courtenay?
It's busier than any other single emergency room on Vancouver Island.
Well, I hear this all the time. People go in for minor things and they wait 8 hours. Yes. Clearly, if you're having a heart attack, they're going to expedite that care and do the best they can. But why is that? Why is it the busiest hospital on the island? Yes, it has the least amount of finances to accommodate its needs. Why is this?
Well, the busiest should be obvious. We have the oldest population, right? We're growing faster than anywhere else on Vancouver Island. And so we're growing really fast. Look at our tourism numbers, right? We're a destination, so we have lots of visitors here as well. And we can't take them out of the equation when we look at emergency room visits. So that's the reason our emergency room is so busy.
I can hear you. You know, when I first moved here with my husband, I used to say it took 15 minutes to get anywhere in Nanaimo, and now it takes 45 minutes because the traffic and the construction. This town is booming.
It is.
Yeah, we need better health care. Absolutely. Also, it says that we are regularly treating over 400 inpatients with only 346-bed facility.
Yeah.
That's a shame.
It's scary. You know, we've seen the commercials on TV, right? We've all seen them and we talk about patients that are being treated in hallways, in janitors' closets, in the chapel. In terms of Nanaimo, we have patients in our chapel on stretchers because we are over capacity every single day. But like I said, the hospital was built in 1962, 62 years ago. So that's how old the infrastructure is. And it was built for a much smaller population, not taking into consideration the trajectory of the amount of people who are moving here, or that the amount of people that are here now, what the age is, and how many hospital visits. So none of those things were taken into consideration 62 years ago. Now I have to say, my grandfather built the hospital 62 years ago. I can tell you, he never thought 62 years later that it would still be the tertiary center of healthcare north of the Malahat, right? He expected that it would have been replaced by modern and updated and much larger facilities than we currently have.
So I think it's important for us to mention that when we talk about NRGH and not being able to be funded correctly with the population and its needs, that we are not talking about the people that are relentlessly saving lives and working every day. They too deserve better equipment. They deserve better surroundings. They deserve better access to quicker care, correct?
Exactly. So you mentioned it early on about why is it difficult to attract doctors here? And I mentioned if you don't have the infrastructure in place, how can you draw a doctor to come and work when you don't have a place for them to work? But I do want to note, our doctors give 120%. Our hospital staff give 120%. Our level of care is spectacular. It's just that they need the proper facilities to provide that care. I mean, when we start looking at statistics, and you've seen the numbers, Dean, I won't talk to you about the numbers. 2 cardiologists north of the Malahat versus 22 south, right? 40 oncologists south of the Malahat versus 0 north of the Malahat. Those numbers are staggering.
Of course. But this just isn't doctors. I mean, we're talking about a boiling pot here. This is from the ground up, even with like housekeeping, maintaining viruses, making sure everyone's in a safe environment, the transfer of things like MRSA or communicable diseases. When you're in a chapel and you're being treated, it's not really ideal for you to be getting, perhaps a safe place to recover, right?
Correct.
So I understand that perhaps some of the people that we would want to bring here may not want to come here because they don't feel the facility is adequate enough for them and the responsibility of taking that on.
You're right on track.
Well, that's terrible. We got to do something. We're going to do something.
We're going to do something.
We're going to talk about that. Okay, so I want to just move over on my notes here, and let's talk about the current healthcare reality. We are not meeting the appropriate standards of healthcare. You just said the 2 cardiacs, the cath labs, largest population. What is the greatest burden of this cardiac disease compared to Central or South Island?
So, I feel maybe I'm repeating myself, but I think it bears repeating. Oldest population, most acute. Number 1 killer in Canada is heart and stroke. And yet we don't have a full cardiac program here, right? So our people are dying. That's actually what the bottom line is here, is that our community members are dying, and it's preventable, a lot of it. If we had the infrastructure that we needed, that we could help those people in a timely manner. And so we're kind of going down this rabbit hole right now, where all those things that you talked about, getting the staff, getting the proper staff and support staff that we actually need, all of those things are kind of converging in this perfect storm where we're now in a state of desperation, where we really need the community to come together and talk about this. And as our campaign is saying, we're not asking anymore, we're demanding that we be given the standard of care that you see across Canada, right? It can't be that it will be some of us who live on the island have to drive for our healthcare. That can't be the answer. That is not the answer. That's not acceptable. But a full tertiary center, and I've given you some slides, which I understand are going to come up, that show all of the programs that we need. There are probably 20 programs that we need for a full tertiary center, and we've been granted 1, right? We've been granted a nephrology program, which is fantastic because 53% of all kidney patients are from north of the Malahat. And actually the head of that program, Dr. Allison Kroom, is based out of Nanaimo. The problem is when you give us 1 tertiary program, those patients are complex. They have multiple issues, and yet we don't have any of the other tertiary programs to back up what is needed for that complex patient. Those patients that need kidney care quite often need cardiology. They need gastric. They need endocrinology. They need those other physicians to back up that comprehensive program. And so even though Nanaimo is designated a tertiary center, we're not asking for that. We've already been designated that by Island Health. Island Health recognizes that we're a tertiary center and that we need a tertiary center. The issue is that we haven't been granted those programs or the infrastructure to grow those programs to support that patient base.
And we all need, it's like a puzzle here. You can't just take one piece of the puzzle and correct it and not have all the other pieces come together. Right?
That's correct.
Yeah.
That's correct.
This is very scary news for if you're watching this show. We're going to talk about the call to action and how we can support this. And you say we need to do action like this. Who is we? I think we need to get this community energized and get people to understand that this affects every single person. It's not just cardiology. We've got pediatric problems, we've got cancer problems, we've got other issues that are not, or other areas of the hospital that are not being able to fulfill their needs. Can you share any of those lightly of what else is missing with NRGH?
Well, there's so many programs missing, Dean, as I mentioned. I mean, I want to talk about the pediatric psychiatry for a minute.
Okay, great.
Because, I've been a parent of a child who's been sick, physically sick and needed surgery in our hospital. I spent 3 weeks in the hospital as a parent sleeping on the little rollout bed. I have one-on-one experience being in the hospital and how great the staff were. And so anything to do with kids, I think, goes to everybody's heart right away, right? If you have a child who needs a psychiatrist, there is 1 north of the Malahat. There are 18 south of the Malahat. The waiting list for your child is a year. How do you explain to your child that mommy or daddy understands that you need help, but there's nobody to help you? It's just wrong. And it needs to change.
Absolutely. I think you know that my background was fundraising for mental health and addiction. Yeah. When I was navigating a project here in Nanaimo, I had a tremendous amount of parents reach out to me to say, my daughter is self-harming, my son is suffering from depression. What do I do? Where do I go? They end up going to NRGH, and they treat them well, and they get them on their way, but at the end of the day, they're sent home with a wait list of over a year. Yeah. How do you tell, like you just said, a child that's self-harming or in a depression that they have to wait a year to get help? It's just not fair. It's actually cruel.
Well, and that's a life and death situation. You and I both know that.
Yes, of course.
Right? That's one program. That's one program. And we have many, many programs that is actually the situation. So you asked me, who is we? You know, the healthcare ecosystem, I'm really proud of them and of that group of organizations who is having the conversation around healthcare, because for the first time, I've been in this conversation for over 20 years. In the last 3 years, that group is all 110% on the same page, talking about the same thing. And then the Healthcare Alliance forming out of that, that's the community coming together, all on the same page. I'm so proud of them, everybody talking about the same thing. And when you say who's we, it's me, it's you, it's every single person watching this show, it's every single person in this community. Because quite frankly, the only way we change this conversation, the only way we get a psychiatrist for that child is by demanding it as a community of our provincial government to fund the infrastructure for it.
I hear you. It's true. I'm emotional. This is a very difficult interview because I can see so many people are suffering or getting inadequate services, and not on the backside of the people that want to help them. It's on the backside of funding. It's the backside of government, and it's the backside of resources. Yeah. So I think we need to talk about why we're the forgotten half of the population that only gets 1/5 of the island's resources. Why is that? Why does the government think that's acceptable? Why are we sitting in this position? How did this come to be?
So a couple of comments I want to make, because I want to be fair in this conversation, because we're not supporting a specific political party. So this, I mentioned it early on. Since the 1990s, there's been pretty much very little funding towards healthcare infrastructure in our area. So it's not one particular government that's ignored us. It's many governments that have ignored us. My personal feeling is that there's no political will here, right? We're strongly an NDP stronghold. We have been forever. So sometimes we have the right party in power like we do now. Sometimes we have the wrong party in power like we have in the past. And so it's easy to overlook us. And to be quite frank, the people of Central Vancouver Island are really hardworking community people that quite often, when they're faced with a challenge and they don't get the funding they need, they come up with creative solutions to do it themselves and work around, right? And I've seen that through my various community roles here in Central Vancouver Island through the many, many years I've been here. And we do it continually. And so therefore, when the answer is no, we don't stand up and shout. We create a solution that works and make it happen in a different way. So there's been very little political will here. Now, in the last couple of years, we've got, there have been some changes. There has been a replacement of our ICU from 9 to 12 beds. I'm saying 460,000 people, 12 ICU beds. Very excited, though, about the high acuity unit beds, which is an additional 12, which will be coming next year. So now we're going to go to 24 beds. That's exciting. It's exciting news. Very long awaited. MSA, Medical Staff Association, Nanaimo District Hospital Foundation, Island Health, working for years together to get that conversation and make that happen. The announcement that we're getting a cancer treatment center, that's exciting news. But it's piecemealing our healthcare crisis by little bits and pieces, as opposed to giving us the full infrastructure package that we need.
Well, it doesn't seem right. I mean, I remember when I first moved to the island, I had met with the executive director of NRGH, and they talked about this 8-bed, the emergency or acute care, right? And I remember thinking, but this town is booming. By the time this gets built, we're going to need twice that amount. So I understand what you're saying. It's a little bit piecemeal, a little bit late.
That's correct.
Okay. So I want to talk about the call to action, right? There's a lot of people going to be watching this show today. There's, power in people, power in numbers. So let's talk about how people can engage in this and how they can help make a difference.
So right now there are two major ways that we are asking the community to join their voices with ours. The first is to sign our petition online. And so that's at weneedhealthcare.ca. Or you might see us at various community events. We would encourage you to sign the petition. And like I said, this isn't about a certain party. This is about the community joining voices to say we're demanding that we be treated fair and equitably with the rest of Vancouver and the rest of the province, to be quite frank. The second thing is we're having a rally on September 12th at 5:30 at Bevan Park. we would ask everyone to join us. Come and join their voices with us. There will be lots of media there. We expect there's going to be some politicians there. You're going to see our full presentation. You're actually going to hear from many of our doctors who are going to get up and share stories. And I have to tell you, that's really impactful when you hear from the people providing the care and how they can't save their patients. And so, it becomes very emotional. And so we want to invite the public to join us and hear those stories and come out and take a stand and show our provincial government that we're demanding that we be treated fairly.
Donna, I wanted to talk about the healthcare workers at NRGH. I recently had a conversation with an emergency nurse at the hospital. It was a great conversation, but I could tell while we were having this conversation that she, on a daily basis, had some struggles. Let's talk about the healthcare workers.
Well, Dean, they live in a very stressful world working inside the hospital. Imagine working through the pandemic, which that's what we've just come out of the last couple of years out of pandemic. But you are in infrastructure that in 2010, Island Health had a report done, 386 pages about the infrastructure. They knew then that the infrastructure itself was failing in terms of life safety systems, in terms of infection control. Their report talks about grossly inadequate. It uses big words like that. So we're putting staff to work in facilities like that. We're overcapacitated, right? So we have 346 beds, but I think 2 weeks ago I got the update, it was 440 patients. 440 patients in a 346 bed hospital. So they know going to work that there are going to be patients in hallways. They know that they have so many patients that they necessarily won't all be attached to a doctor in hospital because they don't have the staff to do that. Right now, our statistics are for every 400 patients, we have 1 internal medicine doctor. If you go to Victoria, they have 6 for every 400 patients. So imagine the amount of care given per patient as compared to here. So we ask our staff every single day to go into that situation. And yet our doctors are the heroes, right? Our nursing staff, our cleaning staff, all of those people, infection control staff, they're the heroes who go there every day to keep us well, keep us healthy, save our lives when we need it. So not only do they have a stressful job, but they work in less than ideal conditions, as we know, and we put them through that every day. So the mental health stress on those people is skyrocketed, right? I mean, my office is on the hospital campus. It's rarely a day goes by that a doctor or staff member doesn't stop into my office to just talk to me. And the care I see for their patients and the stress level I see that they put out for their patients is mind-blowing.
I'm sure. Which brings me to another conversation. When you go to NRGH, I am asking the audience to understand the magnitude of this problem and to be patient with these people and to understand the stress they're under. Going to the emergency, going to NRGH for anything that you need to go to, you have to understand this. You have to understand that the wait is going to be long and they're doing the best they can and they're trying their very hardest. I hear this conversation of the healthcare workers about how not only is it difficult to navigate in this situation, but also to deal with the onslaught of abuse that's coming from the public because the public are not educated and don't understand why this is happening to them.
Correct. And we need to have empathy for them. And to be honest, like during the pandemic, we all beat on our pans and we celebrated them, right? But we haven't been doing that in a while. And I can tell you that the staff at NRGH need us to do that because they need the community to have their back. They need to know that someone's fighting for them so that they can do their job and take care of us. And that's been a big part of the Fair Care conversation, is allowing the staff at the hospital to know that, hey, we care about them. We recognize the stupendous job that they are doing for our community, and we're celebrating that. And guess what? We're also going to fight for them. So they're not there by themselves. They have a whole community surrounding them that are going to support them and fight for them.
Okay, so everyone, we heard this. We go to weneedhealthcare.ca to support this initiative. And please sign the petition on the website. You can also follow them on Instagram and Facebook. We'll put those leads along the bottom here. Go onto their page, like it, share it. Talk to your friends, engage people, write your politicians. Get angry. This is a terrible situation. Vancouver Island needs your support. Everyone in this community deserves health care. Everyone deserves better health care. The people who work within the facilities need better access to equipment and to be able to save our lives. Again, there's a rally on Thursday, September 12th. The doors open at 5:30. The rally starts at 6:30 at Bevan Park. Please show up, be there. This is a huge undertaking for our community, but I think together we can make a difference. What else would you like to share with us?
Well, I think it's really important to understand how much this conversation belongs in the heart of the community. Mm-hmm. And is the community coming together and sharing their voice. And really who we're speaking for is for everybody, mm-hmm. right? This is a conversation that is not about what race you are, what gender you are, what religion you are, which political party. It surpasses all of those pieces. Mm-hmm. And I strongly feel that the power is with the people.
I agree.
And so we need you to vote and vote with your voice that does what's right for our community.
So listen, you heard that. Donate today as well. You can go to weneedhealthcare.ca to ensure excellent care to everyone, everywhere, all the time. So go to their website, attend the rally, and start waking up people. Everyone in this community is going to age. Everyone is going to need, at some point, access to our hospitals, and they're going to need the care that they deserve. So I'm asking you, as the host of Upfront, to please take 5 minutes, go on the website, or show up at this rally, and let's together make a difference. I want to thank everyone for joining us on Upfront. Donna, thank you for coming out, and thank you so much on behalf of the community for this initiative and all the work that you're doing to try to help everyone on this island to access better health care.
Thank you, Dean.
Thank you.